children, usually having their, well, younger women in their first pregnancies. And the reason for this usually is the fact that these are usually poor girls who have been married prematurely, as it were. I think a couple of years ago we had some issues with child marriage in this country. And unfortunately, this still happens in certain parts of the country.
Just a minute. Can you tell us what we're looking at right now on the screen? These are a couple of young girls. We've had their faces covered, you know, for the sake of their privacy. But those are some, you know, kegs under them and tubes leading up to their bodies. What really is going on here?
Now, what is going on here is because these women are leaking continually because of the defect between their vagina.
Okay, because of that hole, that connection,
yes.
They have this urine coming out of their bodies.
Yes.
So they have to go about with those things, you know,
That's
connected
correct.
up them.
That's correct.
So now, in the case of if there's also a rectal or a complication,
yes.
Does that mean that this tube is also going to be bringing out feces?
Well, in the case of rectal connection, yes, you know, the woman also leaks feces continually. And this is where, you know, you have a lot of stigmatization, you know, attached to this. You know, it's quite so embarrassing. It had to be leaking urine continually. Without these devices, obviously, the individual, the sufferer, you know, is surrounded, I mean, will leak continually. Some will use...
And then give off an offensive odor.
Offensive odor, very dreadful offensive odor, you know, either from continuous leakage of urine, which because of release of ammonia gas, you have this stench around them.
Now, this continuous leakage, if this thing keeps going on and there's no intervention, or perhaps she keeps having, you know, a recurrence of this type of thing, what is the consequence in the body? Can it lead to other problems?
Well, the consequences are both physical and, of course, psychological or emotional. Physically, infection, you know, is top. You know, the as you know, feces contains a lot of bacteria as well that uncontrolled urine. So this can spread upwards and affect the urinary tract, the kidneys, you know, causing, you know, pyelonephritis. That is infection of the kidney. And this can, you know, subsequently lead to affectation of the renal function. There are other consequences, either directly as a result of the fistulae or things that occur alongside the fistulae. Like we said, the fistula itself is a result of obstructed labor. There are other things that occur at the same time.
We'll have to take that after the break.
Thank you.
We're calling for a break now. We'll go on a short break. We'll be back in no time. Please stay tuned. Back. We're talking about obstetric fistulae, and this is where you get to call in. The number to call is 012206 482. That's 012206 482. Now, doctor, I imagine there will be some preventive measures that can be taken. For example, stopping of some of these harmful traditional practices that you spoke about. What are some of these harmful traditional practices?
Well, this will include practices such as child marriage. You know, as we said before, some of these women have not really achieved their full developmental capacity.
So we're saying that if the woman is left to grow up a bit,
yes,
she can better be able to handle a labor, a birth of a child.
That's correct.
Okay.
By that, you know, the pelvis canal would have expanded adequately to prevent obstructed labor. The other one, in some areas, I mentioned the gishiri cut, or the Yanka gishiri.
What is that?
Which is commoner in the northern part of Nigeria. Basically, is sometimes used, is a cut in the vagina, a traditional cut in the vagina, by people who have little or no knowledge of anatomy. But they use it sometimes in an attempt to relieve obstructed labor, but they also use it in other circumstances like treating menorrhagia and so on. Also, the issue of female genital mutilation is something that has come to the fore, where you have removal or cutting of parts of the female.
How does that now affect the labor? That's this cutting.
Well, because they really have no basis, they don't, significantly or positively affect labor. Basically, it's just they're inflicting injury that are of no use to these victims.
Okay, then what are other ways of preventing obstetric fistulae?
I think crucially, you can look at prevention, from the primary point of view, secondary, and tertiary. I think from the primary point of view, critically, education is crucial. Educating the girl child is very important. It helps us to achieve a number of things. One is it economically empowers the girl so that as future mothers, they will be able to make the right choices as far as maternity care and utilization is concerned. It also means...
We're having a phone call. We'll get back to that. There's a call coming in. Hello.
Hello.
Hello. Olajumoke from Lagos.
Yes. Please,
Can we have a question?
Private operation. I noticed vaginal has been blocked. There has been no opening through maybe to the vagina. I noticed it very soon. Even though I've lost my husband in intercourse ever since, maybe that has been the reason, I don't know.
Please, you're going to have to do that again. Let's hear you all over again. You were breaking.
Yes, I had an operation, a fibroid operation last year. And I noticed there has been no hole to my vagina, though I urinate very well, but I don't know, but there was an opening through, but later I noticed now that opening is no more there. So I don't know what could have been the cause, maybe part of what they are discussing as saying fistula or whatever. And even though I've lost my husband, I've not done any intercourse ever since. Maybe it's because I don't know. I'd like to know, is there any circumstances for that, or is there any harm for that in future? Thank you.
Okay. She's speaking about a hole she noticed after a procedure, and it covered up. Could that have been a fistula? Could it actually cover up by itself?
Okay. I think, the sort of hole that you will notice, if you've had an operation by yourself, other than maybe leakage of urine, is not likely to be a, vesicovaginal fistula. It is possible that there has been a defect in the healing of the wound, probably an abdominal wound. So that is probably not...
But do you advise a visit to the hospital for this?
I think usually if you have a medical issue that you are concerned about, then it's better to check it out